First, we're going to begin by assessing the cranial nerve 2, which is the optic nerve. We would use the Snellen chart. In real life, we'd have the patient stand 10 feet away from the chart and read the smallest line they can see. For the sake of this video, we'll just talk about it. 20/20 is normal finding. We're also going to test for confrontation. So cover one eye and then tell me when you can see my finger in your vision.
Now.
Good. And you would do that bilaterally, and seeing the finger is a good finding, a positive finding. Next, we're going to assess the oculomotor pupillary response. So I've got a light. What I'm looking for is his eyes to constrict equal with movement. And now I'm going to assess to see when you put the light in one eye, the other will also constrict. This is consensual. Next, we're going to take near response and have you look at this object right here and get closer, and that is a positive near response. You're looking for symmetry or nystagmus, which would be a negative finding. Next, we're going to assess the 3, 4, and 6 cranial nerves, which is the oculomotor, trochlear, and the abducens. So we're going to look for extraocular eye movement using the 6 movements. So I'm going to start by looking, just follow my finger, up, down, right, left, and then you want to go diagonally, which is normal. So then you will see symmetrical movement of his eyes and no nystagmus, weakness, or drooping. You'll also want to assess for convergence. Watch my finger and go closely. And there is no signs of nystagmus or drooping. Next, we're going to assess cranial nerve 5, which is the trigeminal cranial nerve. So I'm going to palpate the temporal and the masseter, and clench your jaw for me. Strength is equal and bilateral on both sides. This is a normal finding. Next, we're going to assess the motor function. So open your jaw and move it from side to side. And he is able to do that, and no signs of weakness or drooping. Next, we're going to assess the sensory portion. So I'm going to start by doing this on the ophthalmic, maxillary, and the mandible. Tell me if this is soft or dull or sharp. And he is able to feel that, so that is a positive finding. Cranial nerve 7 is the facial nerve, so I'll start by having you raise your eyebrows, frown, show your teeth, smile, and close your eyes really hard. And then close your eyes really hard and try to open against me. There you go. All right, and puff your cheeks. Perfect. That is normal finding. There is no signs of drooping or weakness. Cranial nerve 8 is the vestibulocochlear, so I'm going to stand on one side and whisper a number, and he will have to repeat it to me. 8. And you would do that bilaterally. And if you were to have a negative finding where he would not be able to repeat the number, then you would do the Rhine or Weber test. For cranial nerve 9 and 10, it's the glossopharyngeal and the vagus nerve. So I'm going to look at his uvula. So take your tongue out and say ah. Looking at his uvula, it is midline, and looking at his palate as well. Also, you're going to assess his voice during that, and it was not hoarse, so did not show any signs of weakness. And then for the last one is gag. So open your mouth for me, and you would stimulate both sides of the throat to cause a gag reflex. For cranial nerve 11, which is the accessory muscle, so I'm going to have you, I'm going to put both my hands on each shoulder and shrug your shoulders against resistance. The strength is equal and bilateral. And then if you will, turn your head left to right against resistance, and the strength is equal bilateral. And the last one is cranial nerve 12, which is the hypoglossal nerve. Stick your tongue out for me straight. The tongue is midline, and move it side to side. And no signs of weakness or drooping. And that is it.